minute, Mama, please, because we only have a limited time. Because your parents have other things to do too, and doctors too, and he's got clients coming.
This is a special table here. It's called the Decompression Table. It's probably the most advanced table in trying to unlock someone's low back. It also can work on the neck. I have tremendous results with this. I really like it. I do it myself. There's one thing that I don't do that's in this clinic because I believe in all of it. This has it's a computer model of 10 series of pulls, which helps bring more hydration to the disc. The disc gets dried out as we get older. And remember this principle, gravity always wins. So this is an anti-gravity machine or anti-aging because we all degenerate as we age. So it's an excellent piece of equipment. We use it regularly with all our patients. We also do other special testing. This is to check the cardiovascular system. This is checks the flexibility of your vessels. It's been well known and well shown in many scientific literature that as your blood vessels decrease in flexibility, you're aging on the inside, whether you're chronologically old or not. We also work in the bottom here is an ultrasound unit. We use ultrasound to identify small fractures in the extremities being your hand and your feet. We can check the physiology of the body, how it's working to tell you if you have enough intracellular water. Another marker for aging, if you're dehydrating, you're aging. So we have other markers to determine if you're aging faster than you should be aging. And many of the things that we drink today actually cause us to dry out from the inside, such as caffeine, cola drinks. And the fact that we don't drink enough water. And it has to be good water. You're supposed to be drinking plenty of water. We also check the balance of the person. If they're not balanced, we have to use little shims to test them and determine what kind of implants we've got to make for the bottom of their feet, because we want to balance them from all the way from the feet all the way to the head. The patient can then step into a mold, which basically molds the foot, and then we'd sit to a company where we correct the foot posture, and that way we can help balance the patient up. We know the number one principle, like I said earlier, gravity always wins. So if you want to wear out, you want to wear out evenly. So it's very important that we balance our patients up so that they wear evenly in all their joints. This over here is, I have an advanced degree in nutrition. This is very important. Some of the toughest cases, and I've had cases that come from the hospital, come in here because if you don't have the nutrition right for the patient, it's just going to make it that much harder for the patient to heal. And everything is energy. So we have to recapture the body's energy.
I had a spinal fusion back in 2007.
Yeah.
Yeah.
This is like how we teach
I think it's recording. Is it recording?
It is now.
Yeah, it's going to record.
Well, everyone, it's our patient who's volunteered to be the patient today. Okay. But we're going to do a very unique evaluation. My name is Dr. Martinez. I've been in practice for 33 years here in Conway. I've had the opportunity of working in many different places, 3 integrated clinics. Went to Mexico to learn certain injection techniques. I was over what's called a fellow in acupuncture, over 400 hours in acupuncture, 400 hours in nutrition. So my evaluation on our patient, and your name?
My name is Tara.
Tara is going to include a little bit of all that nutrition, acupuncture, and chiropractic, but it's all because there's some kind of an electrical interference. Our bodies actually work on some energetic form, and we're just going to demonstrate some of that if it shows up. I have no clue if it's going to show up or not.
Yeah.
Okay, so Tara would come to our office and she would fill out some paperwork that most doctors that you're familiar with if you've ever been to a doctor. And yeah, we all do it on computers, but it still takes a lot of time anyway. So just come in, get the paperwork done. So we've got the phase 1 part over. Now we're phase 2 with the exam. I've reviewed some of her paperwork. She told me she had a scoliosis and had to have surgery at age 6. So that's some incredible work that was done at Children's Hospital, and that's just great that we have people that can do that kind of work as well. So I would have the patient sit, go ahead and sit right there, and I'd explain to you that you're going to have a very unique evaluation. You'll see some things that are traditional in doctor's offices that we do, and then I'm going to get to the point where I'm going to see if your body is working in a balance, and it is balanced. If it's balanced, it's going to work better structurally, work better physiologically, work better electrically. So we're just going to go down the pathways to see where this, just like a patient would in my office.
Okay.
So, here you go. We would, of course, take her temperature, you know, with everything going on now. We've got to take everybody's temperature. Okay, and she's very good on that. But I would do another test where I'm checking to see if she's hydrated. And I'll just speak because we're having this issue with the coronavirus. I'll just kind of tell you how some of this ties in from my perspective here. Take 3 readings, and she's within the norm, meaning she's hydrating her body. You got to take in water. Our cells, if they're healthy, are going to have about 60% or more water on the inside of the cell than outside the cell, and we're really like little batteries. So if you think battery, you think electricity. So now I want you to kind of look at me as a doctor of electricity for your body. Okay? So I'm going to see if her electricity is working from the brain all the way down to her toes. So I'm going to ask you, let's take off your shoes.
Okay.
I'm going to move this just for
That's
a
fine.
second. Can I put it on the floor?
Yeah, that's fine.
And even though she's got the skinny jeans on, I can still bring her pant legs up a little bit. And the reason we go all the way down to the feet is because it's the furthest distance from the brain. So certain things should be working. Her muscles that control her toes, the nerves that go to her skin should all be the same. So there's no right or wrong answer, but I'm just going to ask her, here, tell me, does that feel the same as that?
Yes.
And she said yes, so I move on. Does that feel the same as that?
Yes.
Very good. Come on in. Does this feel the same as this?
Yes.
Now we're going to go to a higher part of her brain and we're going to say, does she sense my hands touching her? So here, put your hands on your thighs like that. I want you to imagine that these are your feet.
Okay.
So that would be your big toe.
Okay.
I'm going to ask you the questions here. How many toes are between the toes that I'm touching? And you would say 3.
Okay.
I would say, how many toes are between the ones I'm touching? And you'd say
None.
Got it?
Okay.
So close the eyes.
Okay.
How many toes are between the ones that I'm touching?
3.
Very good. How many toes are between the ones that I'm touching?
1.
Very good. How many toes are between the ones I'm touching?
1.
How many toes between the ones I'm touching?
None.
Great. How many toes between the ones I'm touching?
3.
How many toes between the ones I'm touching?
2.
Good. You had to kind of guess at those last 2. So we're going to go to, I'm keeping that in my head now. We bring the big toe up. Really bring that big toe up for me. Bring it up. I'm going to push down.
Okay.
Her nerves are working right. She should be able to keep that big toe up. Don't let me push down. Put that big toe up. Don't you let me push it down. Okay, this one. Big toe up. Don't let me push it down. Don't let me push it down. Don't let me push it down. This one. Big toe up. Don't let me push it down. Big toe up. Don't let me push it down. Which one have you sense is weaker?
This one.
So the
For
patient
sure.
knows something is up. Even though she didn't come in here complaining of that, I have to make sure I go the farthest distance from the brain or the big battery. Remember, she's a big battery. So now I'm going to go about midway, and I'm going to see, I'm going to check her skin because that's where the nerves go from the neck. So, here, let me know, does that feel like that?
Yes.
Does that feel like that?
Yes.
Open the hands up. Does that feel like that?
Yes.
Does that feel like that?
Yes.
Very good. Now I'm going to ask her to put your little finger and your thumb together. She should be able to hold the strength equally on both sides. Hold it. Hold it. Hold it. Hold it. Now, I'm a little concerned just because they're kind of weak, so I might ask her what she's doing. I'm seeing if she's losing any muscle in these areas, because that's one of the areas you'll start to lose muscle. So I'm just kind of looking to see if she's losing any muscle, making sure everything else is normal here. Put the hands up like this. I'm going to push down. Don't let me do it.
Okay.
And I'm going to push forward. And just put your hands up. And I sense something else. She had very cold hands. So people with cold hands normally, and she has very cold toes. So people with cold hands and cold toes, I'm always suspecting possible thyroid issues or a deficiency in selenium, which helps the thyroid work. And so we're going to be checking that as well based on our exam here. Okay? And it could just be the nerve energy is being blocked. So we're going to really check that part next. So hands up like this. I'm going to pull. Don't let me do it. She's strong. I'm going to push. Don't let me do it. She's strong. Hands open like this. Be strong. I'm pushing. Good. I'm going to push again. Very good. And I'm going to push one more time. And what I'm checking is something for evenness. It all should be even, but I sense something wasn't even over here. Yet her, when we did the pinwheel, everything appeared normal. So I sensed it again, so I'm going to go looking again. Something just to make sure. Does she have normal tone in her body? I know she had this amazing surgery at age 6, but I complimented her earlier that her posture seemed to be pretty good. The doctor did a great job. So I sense something amiss. Could be a shoulder here, could be her neck, could be actually in the brain. Not normally, but I see this in a lot of car accidents, is the eye and the brain are not coordinated together, so I'm going to check that first, and I'm going to tell you exactly what I'm going to find. Right now, she's strong. She puts her hands out, she's very strong, but if she can't control her arms and it goes weak, then I'm on to something, and I know something is going on between the communication of the brain and the body, or the electrical frequencies aren't working correctly. Okay? So, hands up, you be strong, I'm pushing, and she's strong. Only the eyes. Move the eyes as far as you can to your right. I'm going to push, give you a fair warning, and she's strong. Look this way, only the eyes, I'm going to push.
What just happened?
I didn't prompt that. Tell them what you just said.
I don't know. On one side I was strong and the other side I couldn't help it.
Well, let's do it again, because it could be just that, I caught you off guard or I pushed too hard. Eyes only that way, and she's strong. Eyes only this way,
Oh my God.
and there's no strength. Now, I want to show you how your body electrically works. You, little one, come here. You come over here, and you hold Claudia. You don't mind her being in your video?
I don't mind at all.
Hey, Claudia, you come over here. Now I want to show you how electricity works in the body. We have Claudia. Be strong. And Claudia is strong. I'm leaning on the body. And your name?
Melody.
Melody. What a pretty name. I'm going to push down. Don't let me do it. And Melody's strong. Now, I want you to go ahead. We're going to do it 2 different ways. Melody, you hold Mom's hand. And Claudia, you hold Melody's hand. Now, this is kind of like if you had cattle and you're trying to keep your cattle in the fence. You're going to use an electric fence, but someone wants to play a trick on you when you was in high school, so they got all of you in a line. She grabs the wire, but she gets zapped. Okay? So it kind of works off that principle. So I'm testing you, but I'm using her muscles. This is how we do little babies. This is how we do the very elderly that can't move their arms. We have to use what's called surrogate testing. So, Claudia, I'm pushing only the eyes that way. Claudia's strong like you were strong. Only the eyes this way. And there's no strength there either. Okay, so we know we've got an issue here, but the cool thing is we can correct that. Right now her body is energetically inefficient. Therefore you're losing your inefficient energy user. Therefore you're not healing to the best of your capabilities. So let's go ahead. Do you want to feel that? What it felt like? Okay, well, she wants to feel it too. You be strong. Be really strong, little one. You don't feel like you're going to be strong for me. Stronger. Super strong. Okay, Mom. Eyes only that way. Be strong, little one. Okay, eyes this way. Be strong, little one.
Now it's home.
You know what's home?
Did you see that? So there's a disconnect. So we got to reconnect. And this is a perfect example. We see this a lot in people in car accidents, people that have gone through traumas. So I'm going to give her an exercise right now, and she already witnessed what it felt like. So I'm going to give you the exercise. You're going to do 10 of them, and we're going to see if that's created a change. Okay, so what's happening here, we actually are looking at each other with our brains. We just have these things called lenses in the front, and we call them eyeballs, but the lens and the brain should all be in one alignment like that. They shouldn't be like this. So I'm going to see if these little exercises are going to help correct that out. So when she moves her eyes to her left, she goes weak. So I've got to get the eye and the brain coordinated back to the right. So I want you to look, pretend there's a bullseye right on your thumbnail. You're going to, your body is already geared and already in place that whenever you move your head towards, or when your eyes even move to the right, your muscles already want to contract. So your head's going to try to move. You just hold your head, don't let it move.
Okay.
We're going to go to the extremes or to her peripheral vision so she can still see the bullseye. Do you still see your nail?
Yes.
Then you turn your head to your nail. Don't take your eye off the bullseye. And then you're going to come back, but you're not going to cross the midline, because if you go into that across the midline, you're going to enforce the weakness. And we're not trying to enforce, we're trying to bring balance back so the electrical system of our bodies work correctly. Turn your head to the bullseye. Keeping your eye on the bullseye. Turning your head to the bullseye. Keeping your eye on the bullseye. Now turn your head to the bullseye. And I want you to do 5 good ones by yourself.
Okay.
Moving your hand to the midline. Don't cross the midline. You're focused on the target and you turn your head to the target. Very good. Another one. Good. She's not moving her neck. Although, don't move the neck. Don't move the neck. Your body. Now keep your eye on the target. Turn your head to the target. Excellent. And it's normal for your eye that you're trying to train to go back in the right position. It's normal for it to try to come off the target, so you got to fight it. But just like any and all other muscles that we use, you gotta do the work to get the muscles to work to make the changes that you're trying to change. Excellent, good job. Give me 3 more good ones.
Arm hurts.
Are you getting dizzy? Don't move that head. Your head's moving.
Dizzy, just,
Holding your arm up.
yeah.
Okay, this will be the final one. Take your eye to it.
15 minutes. Patient consent.
Good. Okay. Hands up. Shake him out. Shake him out. She's a little tired from doing that.
That's bad.
You be strong. And she's strong. Move your eyes to the right. She is strong as she was before. Move your eyes to the left. And she's much stronger than she was before. Okay.
That is amazing. Feels the difference.
So in her case, something in her history told me I better check upstairs first. So that was the most important one. Now we're going to check. We're going to go downstream to see what other areas she may be losing energy from. Because remember, we got to recapture that energy so she can heal. So we take this book. We're going to put that book underneath this part of your pelvis. This happens to already be out of position. And I put this book underneath the pelvis and cause it to go further out. It will be too much of a stress for your spine to handle and your arms will drop again. So we're going to try it out. Under this side. Hands up. You be strong. And she's strong. Strong. And she's strong. I would say she's strong. Good. Now we're going to work our way up from the pelvis and we're checking her low back. So lean, scoot over just a little. There you go.
Too much.
You were kind of going in this crevice. I didn't want to get into the test. Be strong. I want you to incline yourself towards me. I'm going to push, and she's strong. We're going to rotate the body, because when she rotates, her spine also rotates. We're going to rotate the body. Lean towards me. When you lean, you isolate the low back. I'm going to push, and she's strong. I'm going to come over this way. Lean towards me. I'm going to push, and there's nobody home. She's going to lean towards me, I'm going to push, and there's nobody home. Okay? So I know that her vertebra in her low back is rotated with the spinous to the right. So we know something else about you. I would want to take x-rays of your low back, because if I'm going to work on your house, you would want me to have blueprints. Okay? The next part is I'm going to look at her thoracic spine or her mid-back. Hands up. By the way, in this coronavirus, it causes the surfactant fluids of your lungs to be so thick that we unfortunately suffocate in our own fluid under mucus. So it's very important that the lung expand like it's supposed to expand, and for that to happen, she has to have all her nerves working like they're supposed to coordinate that movement. Also, deep breathing exercises would probably be something we all would want to do right now. We would want to be taking, want to be eating foods that create less mucus in our body. So right now, all dairy I would tell people to be off of. I would have people not eating a lot of ice cream or stuff that, all that stuff that's going to cause mucus to develop thicker. We want to stay away from all of our offender foods, because offender foods are going to cause inflammation, and inflammation is the hallmark of all our diseases. So we got to reduce inflammation naturally.
Okay.
So hands up. I'm going to rotate the spine. Is her thoracic spine working as best it can for her? Is she getting that adequate nerve supply? I'm going to push. Turn your head as far as you can that way. This isolates the thoracic spine. I'm going to push. I'm going to push, and she has something is in her thoracic spine where her thoracic spine isn't working as good as it should be. So this is the thoracic spine in the middle is tied to our autonomic nervous system. and that means your ability to deal with stresses and stuff. So we want to get that working as strong as possible. Hands up. And remember, this thing attacks the lungs, so when something attacks the lungs or doesn't allows us to exchange oxygen, we can't breathe. So, it affects the lungs, so we need to make sure and clear all our pathways. I'm going to push, and she's strong. So, we know she's got rotation in her thoracic spine. We take some pictures to know exactly where we're going to do our work. Turn your head that way. I'm going to push, and she's strong. Turn your head this way. I'm going to push, and she's strong. Back to neutral. Side bend your head. I'm going to push. She's strong. Side bend your head. I'm going to push. I'm going to push. She's strong. Shake it out in case you're getting tired.
It is. It's like right here.
Now, the top two vertebrae in the body are the most serious ones because that's where our brainstem is the thickest. Our brainstem is the thickest here. So we're going to check those out. I'm going to check how her skull sits on her first vertebra. So right now, I'm going to take this one arm, because this one's wearing out on her. I'm going to push, be strong, and she's strong. Turn your head that way. I'm going to use a special technique where I'm isolating one vertebra, be strong, and she's strong. Turn your head this way. I'm going to isolate that. I'm going to push, and she has nobody home. So we know that vertebra is not in its right place. In other words, she's losing energy. Her batteries aren't working as best as she could. She needs her energy to heal. Turn your head that way. I'm going to push, and it is a true one. She's weak. Now we're going to come over here. Side bend your head. This is the top bone of the body, the atlas. Be strong. Atlas held up the world. Side bend this way. And she's way out. So this young lady is like having a 12-cylinder car, and she's only working on 6 cylinders. Okay? So she has a nice smile, but I'm still going to check her jaw out. Tighten your jaw. Barely open your jaw. Wide open your jaw. Good. Tighten the jaw. Barely open the jaw. Wide open the jaw. And when she wide opens the jaw on this side, she has a weakness. So once again, she's lost the energy in her low back. She's lost the energy in her mid back. She's lost some energy in 2 areas of her spine up here and her jaw. And then her eyes or brain aren't coordinated, so I know she's not the most efficient as she was made to be. So we want to make sure and assist her, and the power that made the body heals the body, so we want that power's already in her. We just got to free up where she's having interferences and not allowing her energetic system to work as best it can. Now I noticed something else in the exam. I want you to stick out your tongue. Now, if you bring the camera in closely, you can kind of see where she has scalloping around her tongue. This lets me know that there is a food that she's sensitive to. So the next thing we're going to do is, in our exam, is to check for certain foods, because it's all about energy. In Chinese medicine, there's good energy and there's bad energy. And our food can be good energy for us or it can be bad energy for us. So let's come on over here for this part of the exam. We get Tara to stand and face me. We're still using the muscle test. It's not a strong arm muscle test, it's just a reflex test. And I'm just saying, I'm giving her brain a command and the body executes the command. So far so good. Now I'm going to bring down some of the most common foods that we all eat. Here's the first one. Be strong, and she's strong. Not a problem with that food. Here's the next one. Be strong, and she's strong. Back down. Be strong, and she's strong. Be strong. Did you see that?
What is
now,
It's dairy.
Dairy, the one that's going to cause the most mucus forming in your body. So you got to get off all dairy right now. Okay? So dairy. Problem is, you genetically could have gave it to this one. So we actually need to check her for issues as well. Put your hand up. First of all, hold mom's hand. You be strong. And she's strong. And she's weak. Okay, now you hold this. You be strong. Be strong, little one. And she's weak, so I wouldn't be giving her dairy. You can have soy, you can have almond. Take it back. You can't have soy. You can have almond. You can have rice milk.
No dairy.
What is that? What is
Dairy.
What is dairy?
Milk.
No.
Cheese. Ice cream.
No.
Yes.
No.
Yes, dairy is, she's sensitive to dairy, but sometimes it just requires an enzyme. And I'm going to see if this enzyme that we have here would help her to offset that.
No. No. Why?
This one is lactic acid. This one is lactitins. By the way, one of the things about the coronavirus is a buildup in lactic acid as well, so you need to dissipate that. Hold that in your hand. You be strong. And she's strong. See? I'm holding that one.
That's dairy.
Okay, good. This one? Did you see the difference?
Yeah.
Now let's see if it works this way a little. Be strong. And she's strong. Take this one away. Be strong. And nobody on. So this enzyme, the energy that the dairy creates, the enzyme, the energy that creates balances them out.
Okay.
It's not anything magic. It's all based off of scientific periodic chart of the elements. So that's true chemistry. So it's nothing hocus pocus here. You know, if you got one energetic field, you got to counterbalance it with another. Okay. So today, checked her out. We checked her out structurally. We checked her nerves out. We checked out her physiology when it deals with nutrition. And then lastly, because we got all this stuff with the virus out, that also has an energy. That virus has a certain energy. And what we want to do is we want to just screen. So I'm screening people. In the study of homeopathy, it's the energy of things. You know, all the things that you see in life are made out of that periodic chart of the element. All those atoms of that element have a neutron, a proton, and an electron. And when you think electron, you got to think electric. You got to think electric. So yes, we're all electric. So I'm just going to screen her, just like she touched that and made your arm because of your nervous system. Put you here. Be strong. Put you here. You be strong. She's strong. You touch it here. You be strong. And she's strong. You touch it here. And you be strong. And she's strong. So that's good. Now, just because I got her little one, you come over here. You come, Mom, you come here. I just tested Mom and she was strong, so she can actually be used for the surrogate testing for the little one. Be strong. Little one, put your hand just on that group. And she's strong just on this group. Be strong. And she's strong just on that group. And she's strong. And just on that group. Now, Mom, I want you to make sure you're moving your arms so you're not tired.
Okay.
Be strong. And would you say that's weak?
It's a little weak, yeah.
Okay. So we found one, Miss Kate, the parasite energy. So what we're going to do is we're going to walk over to this other room. Okay, little one, you sit there. Mom, you come over here and hold her hand. Now, put your hand on that group only. And she's weak.
Okay.
So because everything is a frequency, this here is the latest pulse electromagnetic field therapy, and I'm going to try to match that energy that the little baby's got and knock it out. So, I'm going to put this little ring on her. I'm going to go to the level 1. So there's a frequency running, but I don't know if it's the frequency to counterbalance that or not. I got to test the mother. Strong? And nothing changed, so it didn't do anything. Mother has daughter's hand. In this case with the coronavirus and so much going on, we kind of screen from an alternative, integrative, and homeopathic process of screening for what are called immune burdens. Immune burdens are viruses, which of course can have your temperature up and a runny nose, bacteria, which of course can have your temperature up and a runny nose, fungus, which of course can have your temperature up and a runny nose, parasites, which of course can have a fungus and a runny nose. We all have that in us anyway. We just have to keep a healthy body. We keep what something is called homeostasis, which basically means balance. So all those little bugs, and there's more of them than we actually have true living cells on our body, are in a balance with us. We are the petri dish. We feed the bugs. So that's why the diet's so important. Like in your case, dairy. So I know her petri dish with a lot of dairy is going to make it really a hot spot for bacteria to thrive. Okay, so, and mucus build up, things that build up our mucus, right? Okay. So right now she's actually having therapy. This is the pulse electromagnetic field. We found the frequency that was causing or has caused an energy disturbance. We've used mother to verify what's going on. And with mother we went through several frequencies until we found the frequency that actually worked to cancel out the energetic field that's disturbing her energy to allow her to be in a proper homeostasis with the parasites. So we're catching something before the patient even has a symptomatic problem, and we're knocking it out early. And this is energetic medicine, and it'll be big in another 100 years, but right now it's just looks strange.
So I do have a question. So whenever you were doing the test on me, and it seemed like this side was more weak than this side all around throughout the testing that you did. So what could be something that I could do to work on that?
This is an excellent question. That's why our next step in our exam process is to take x-rays. Because, for example, if you look at someone's x-rays and the neck is bent this way as opposed to being straight, and then you question that person about their occupation, she might say, I'm Millie and I answer the phone for the church. And I answer the phone for the church. And I answer the phone for the church. And then you look at Millie's x-rays and they're bent like that. You're going to grow to the environment you place yourself in. Although she's had a scoliosis. So before she even was able to have an occupation, her body was already working kind of against her. She could have had a disturbance in the top energetic flow at birth, which I think that takes which contributes a lot to the scoliosis patient. She could have had a structural fault occur when she was very young, but most of the time I see this most likely happens in utero. When I'm in church and I see families walking up to the front of the church, you can see the little kid walking like the dad or the mom, and you know that this posture and genetics is passed on, so you have to interrupt it. So there will be certain exercises that have to deal with what's called the cross-crawl patterns of her body. Cross-crawl patterns are primitive movements which we all had at birth. And that's why when a baby crawls, they crawl like this, and like this, and like this. And if you see a little baby crawling like a little army man with his leg coming up like this, you know his nervous system isn't working to the best of his ability. And we have to interrupt that and add some corrective exercises, which the mother does for the baby. In this case, I'm going to design an exercise program based from your spinal x-rays and based from your coordinated movements to determine how I can power on your electrical system. And then at a later date, we repeat the test to see if these structural faults are gone, to see if the enzyme is working with her dairy or to just eliminate dairy. And again, all in an effort to recapture energy. We've got to recapture the energy. We've got to direct the energy to the right spots so the body can heal. Do you have another question? Did I answer it or
You
did
did. You answered my question. That was really thorough. I liked it. She has a question. What's your question?
I don't have a question.
I thought you were just trying to ask me a question just now.
No, I was asking a question.
Well, what were you asking?
I said, now I can't have ice cream anymore.
Oh.
Have you ever tried rice cream? It's delicious.
Now I can't have ice cream.
Almond ice cream.
You haven't even tried it.
No.
Another part of the exam, in this part of the exam, because she was feeling like a lot of this symptoms that we came across or energy deficits were showing up on her left side. Again, it queued something up in my brain and said, let me make sure I'm checking her total posture. So we take some bilateral weight scales. And how much do you weigh?
114.
Okay, so she weighs 114, so she should be 57 pounds on either side. You would assume or you would think that. So step on the 2 red feet,
If it's what I weigh.
look straight ahead, and don't look down.
Okay.
So we let her kind of move her around a little bit so she balances her body weight out. Okay, take a deep breath, let it out. And she's about 68 on the left and 50 on the right. 68 and 50.
Closer to 120?
Well, the important thing is 68 and 50. That's a lot of difference.
Oh,
Step off.
yes, that is.
Okay. So the difference is this. Fast forward, how old are you?
I'm 30.
Fast forward another 30 years, and she's carrying, did we say 18 more pounds on this side?
Yeah. 19.
So she goes to the orthopedist and she says, my knee is killing me. And the orthopedist says, fast forward 30 years, well, it's old age. And you should look him in the eye and say, isn't this knee as old as that knee? Didn't they all go everywhere together? What's the problem here? Why am I not needing 2 surgeries? The problem is all down to balance. So if you're not balanced evenly, you're going to wear out unevenly, and you're going to have a lot of unnecessary surgeries if you don't. I'm not saying surgery is never in our future, but I'm just saying let's live a balanced life so that we can limit and extend our lives so that we don't have to have these surgeries earlier as opposed to later. Now you're going to step up here. You're going to put your right foot in the glass.
Right here?
Yes. And you're going to look straight ahead. This is going to take an infrared picture of the bottom of her feet. It's going to show where the stress points are on her feet so that I can better help her. Looking straight ahead there, don't look down. Now slide over to so your left foot is in there.
Okay.
Just come on, slide on over.
I'm putting my right foot in?
Put the left foot in there. No, left foot here. And you just kind of move around. Had you had a problem knowing your left from your right? Are you that person?
Yeah.
Are you?
Yeah.
Okay, that's all right. Just remember, the left hand has the L on it.
And I am left-handed, so.
Looking straight ahead. Excellent. Okay, let's go ahead and step off. And I'm going to show you your pictures here.
I'm a freak.
This is our
So
example.
weird.
Looks like, okay. The red shows you where the pressure should be. This is our example. And this is how we should carry our weight, kind of like a tripod. And this is our patient Tara's. We're going to colorize it now. We actually have 3 arches. We have the arch that everyone knows about, but then there's a lateral arch on the side of our foot, and then there's a one that's up front on our foot that keeps us from having hammer toes. So we see in her case that she should be holding the pressure here, and then we see that her lateral arch is starting to break down. We do see that her arch that we all know about, the middle arch, is still doing okay, but she's getting this breakdown, which will eventually lead to a fault. So when I take her x-rays, I'm going to be really looking to see if, because she had 18-pound difference on one side of her body, I'm going to see if that she has a short leg. I'm going to see if her pelvis is causing her to have more weight on that side, because we've got to get her back to balance so her body functions better, both chemically, physically, emotionally, and of course you got to have good thoughts, because that keeps us going in the right direction. So it's a big part of healing, is to have positive thoughts and just know that you're going to get better. And this is a reflex test, so I'm going to find a strong muscle. I'm going to push, match the resistance. So I'm going to push, match the resistance. So he matches the resistance. You really don't have to climb up there because it's not a... Match the resistance, good. So now he understands what's going on. I'm going to start with the foods. Be strong, and that one's doesn't create an interference with his nervous system. Strong. That one doesn't create a nervous system issue. That one doesn't create a nervous system issue. Doesn't create a nervous system issue. Doesn't create a nervous system issue. There's a little drop there. Did you feel that drop?
Yeah.
Okay. So he's kind of leaning over. Look at him.
Now you get to feel it for yourself. That's crazy, isn't
No
it?
leaning over.
That is so weird.
You cannot control it.
So I've won millions of dollars in an arm wrestling contest when I find out what their
Hold
weak,
this, hold this.
what their weak food
Oh,
is.
man.
They put their favorite peanuts right there.
Terrible.
So peanuts for him, so he can have
He
almond
loves
butter.
peanuts. He loves.
Hold on, I need a.
He can have other nut butters. Okay.
Wow, I'm the same way.
I know.
Now he could say, "Listen, I'm not giving up my peanuts for anybody."
He's not.
And he says, "Dr. M, find an enzyme that works for me." So
Yeah.
you come over here. We already know he's going to be a little weak. So this is a vegetable enzyme. Be strong, and made a difference, didn't it?
Wow, yeah.
We take it away. Outside is electrical field. We all have an electrical field.
See,
We put it back in his electric field.
let me ask you an honest
Yeah.
question. Whenever you were watching this and you were recording it, did you feel like
Yeah.
I was maybe like making a little bit of it up or whatever?
No, I saw the surprise on your face.
Yeah.
You're freaked out by it.
Your
Yeah.
face is too right now.
So Ty cannot have peanuts.
Well, unless he's going to have some Enzacor
Yeah.
enzymes.
He's not giving up his peanuts, I can tell you that. This guy
No.
eats a gallon of peanut butter.
A gallon of peanut butter.